There is no osteoarthritis in the knee joint without a pre-existing meniscal degeneration or injury to the meniscus. There is no lumbar spondylitis or cervical spondylitis without a pre-existing disc degeneration in the spine. Both the intervertebral disc and the meniscus at the knee joint falls under the fibrocartilage category. It is this cartilage which is predominantly taking the load in the spine as well as in the knee joint respectively. If this cartilage is undergoing wear and tear or thinning out, then the load will go to the adjoining segment, which is the bone to bone in the knee or the facet joint in the cervical or the lumbar spine. So even when someone has an arthritis in the lumbar spine, the arthritis is triggered due to the degeneration of the disc. So people say that I have a spondylitis, I have arthritis. They need to understand that it's a fibrocartilage damage first that leads to the damage of the hyaline cartilage, that further subsequently lead to the bone damage in the lumbar spine as well as in the knee joint. Every doctor or the therapist who treat the back pain and neck pain and arthritis at the knee joint, they should understand this physics first, that preserving the fibrocartilage, that is preserving the meniscus and preserving the disc, or at least avoiding further damage to the disc and the meniscus and protecting the disc and the meniscus will be the first line of treatment to all these patients who are having degenerative arthritis in the spine as well as in the knee joint. In fact, once the degeneration is set in, it will never regenerate, but at least you can arrest the further progression of the degeneration, thereby the inflammation reduces and pain reduces, and you can preserve the joint and the rest of the cartilage for the rest of the life without needing the surgery. Thereby you can avoid further pain and disability. So preserve the cartilage.